Hi again, patients. This is Dr. Chad Rolland from Rolland Chiropractic. I'm coming to you today asking, why don't you feel good? Patients ask me sometimes, I just have this nagging pain or this fatigue, or I just have these headaches, or I just can't explain, I just feel blah, and I don't understand why I feel this way. And I'm trying to do some of the things that I think I should be for making healthy choices. As you know, our bodies are complex and designed to function in a certain way. Just like your car, it needs good fuel and regular maintenance. Of course, you can drive it for years without proper care, and then when the warning lights come on, you know it's definitely time to get a checkup and see what's wrong. Is it serious? Well, the same question can be asked for you personally as an individual. Are you really healthy? You know, sometimes we say, oh, that guy, I knew Joe for a long time and he was just dropped dead of a heart attack and he was healthy. I don't understand. He had no health problems. Just listen to that statement. Healthy people don't just drop dead of a heart attack. He might not have known he had a health problem, but he did. We have other examples of people, all of a sudden he found out he had stage 4 cancer. And then 4 weeks later, he was gone. And I've had patients like that myself. They come in, I see him just once in a while, a couple years later, they're like, oh, he just found out and all of a sudden he had passed away. And we go back and we say, are you really healthy? How do you know? If I took a piece of tape, how would it be to put that over the warning light on my dashboard and just keep driving away, just keep driving? Is my body sending me signals that I'm just ignoring or not listening to? Or are they so subtle that I'm not able to see them or be aware of them? Is a yellow caution light something that's blinking and getting my attention? Or is it a red warning signal and we're waiting until the last minute? Get tested and find out what needs to be fixed now so that you don't have that story told about you. Oh, we thought he was perfectly healthy and then all of a sudden he found out. I'm going to show you a testing program that we're using in our office. It's something fairly new to us in 2018, 2019, and now we're doing it more. And it involves standard laboratory testing, hair analysis, urine analysis, and it looks at a number of things, over 100 different items in your body. Has a computer analysis of that to give you a personalized printout of nutritional supplements that are selected to help correct imbalances and problems and dysfunctions that are identified in your blood work and in your other testing. Now if I look, I'm going to show you this little binder right here. Talks about testing. This is a sample that I have. This is what the testing looks like when it comes back. We get this color-coded laboratory results. First of all, it'll show, okay, blue is the worst, then red, that's a big problem, yellow is caution, and white is normal. It gives a listing of all the different lab ranges as far as they're shooting for, and these are all the different things that are getting tested on this side. And it compares what happens in a test now to what happened in a test from the last time so that you can clearly see how things have changed. Here's an example. If something goes from one color to the other and you can see the improvement, you don't have to take my word for it. Hey, I think you're getting better. Although you might feel better, that's also, as we know, not an indicator as to how healthy we are. But the results don't lie. If you look and you see, oh, my cholesterol numbers are improving, my thyroid numbers are improving, my liver enzymes, they're improving. I have other things in my white blood cells or my red blood cells, my anemia or the strength of my white blood cells, other characteristics of my body, they're improving, then you know, okay, I'm improving. How do I get this report in the first place? Well, here's what we do. Patients come in, or they can do it through the mail. We're doing a lot more telemedicine in 2020, and they fill out a questionnaire online, or they can mail it in, and I'll enter the data in the computer for them, listing all the different complaints that they might have and the different problems they have. Also, listing medications that they take, because as you might know, we'll talk about it later, certain medications, they actually deplete vitamins, or they affect other parts of your body in a negative way for side effects and for other types of nutrients that are a problem. So you need to know that so that you can at least supplement those or consider and talk to your medical doctor about the complications that they might cause for you. When I look at here, so then I have the medications listed. Now I have other symptoms listed. Then what happens, we take the testing, it all gets put in the computer system, and when it comes back, each section will have an explanation about a particular part of your body, whether it was good or bad, what the problems were, and then at the bottom of each section, it gives a listing with some recommendations for supplements to take to help correct and support and balance that particular problem. It goes on and gives you explanations of the different parts that are a problem, talks about things that are good as well. Some lifestyle recommendations are included in the report, and then again we get back to the different results from the lab study. This particular report is approximately 15 to 20 pages for the average person, gives a lot of detailed information. All that information then we can discuss, you can review it, it's a hard copy for you to keep. Then in the back we look and we put together a customized nutrition supplement plan. It'll give a listing of the different vitamins and supplements that this particular patient is recommended from the computer analysis of their lab work, and it gives them a program as far as how often and how much they should be taking based on their age, their body size, etc. And then it puts it together in one plan. The patient then begins that plan. After a few months of continuing on, they'll come back, discuss how they're doing, and then do a reassessment. Oh, we need to do another series of testing. When you get the second set of testing, it comes back, and then you'll get, again, a comparison of the different blood work and the different laboratory results and showing what's improving or what's not improving and how it needs to be changed. So again, you don't have to take my word for it or even believe your own body. You can take a look and follow the numbers. Now, this particular testing, some of my patients come in and they say, Dr. Rolland, I don't understand. Why is it that my medical doctor doesn't do this? Why doesn't he use nutrition? And why doesn't he use this in his practice? And the truth is that let's start and give credit where credit is due, that sometimes, many times, patients come into their medical doctor, they're only there for a short period of time, and they say, Doc, I just want a pill. I don't really want to change my lifestyle. I don't want to stop smoking. I don't want to start exercising or sleeping more. I just want a pill. What can you give me? Oh, by the way, I saw this on TV. Can I get that medication? Because it looks like it'll fix my problems. Now, is it really fixing the problems, or is it masking the problem and covering up the symptoms and just treating the patient? It depends on the medication, but in many cases, it's just overriding the patient's normal body functions and causing something to occur. It's either pushing something up or down. We'll talk about that later in another video. But they look at that, and the doctor has to listen to what the patient says, tries to help them as quickly as he can, find out what they want and what they're looking for. But beyond that, there's a couple issues that you want to consider. First of all, most medical doctors at this point, and even some chiropractors, but not so much, most medical doctors are now employees of a hospital network. They are employees, and so they are given directions. I've talked to a few of them, and they've told me about this, that they're given directions as to how many patients they're supposed to be seeing and the standard of care that they're expected to treat the patients while they're in their practice. They don't have the level of autonomy that they used to have, even though their license still gives them an open scope of practice to do whatever they choose to do to help the patient. The fact that they're an employee does not allow them to do that anymore. They're dictated by their provider network. Some have actually stated this in the nutritional program. There was a doctor out in Ohio. They came to the doctor who started this program 20 years ago, and he said, I love this program. It's helping my patients. But the hospital came to me and said, you can't do this. You can't have a nutrition program and have hospital privileges. If you want to do that, you need to choose between one or the other. And the doctor, who's a medical doctor, said, I need the hospital privileges. I can't give that up. So I'm trying to do this a little bit on the side, but I'm going to have to stop doing this official program for my patients. And it's just tragic that the doctors have to choose that between those two choices for their patients. So that's number one, who dictates how the doctor has to practice now. Number two, many medical doctors, in fact probably most, all of them, are so busy with their medical care, trying to learn about the latest medications, keeping up with high-tech procedures, that they just don't have time to learn and keep up with the latest nutritional research. On top of that, most of the time in medical school, if medical doctors, because again, their curriculum is so filled with many other things for medical practice, if they have even one class on nutrition, and it used to be even less than that in some cases in the past, it's changing a little bit now because of the issues and some of the efforts to include that. But if they even have one class in nutrition, it's a lot. Whereas chiropractors or naturopaths or acupuncturists and Chinese medicine doctors study nutrition as a regular core part of their practice, numerous classes, and then continuing education later on. Does the average medical doctor take continuing education in nutrition a couple times a year like I do? Probably not. They take pharmaceutical education and the reps come by with the latest drugs and say, hey, here's the newest thing that you need to recommend to your patients. So that's the second thing to consider. They don't have the education for it and they're not able to keep up with it. They just don't have the time to feel comfortable recommending those to the patient unless there's a few things. They might recommend, okay, take a little vitamin C here or something else. Number 3, many medical practitioners, possibly they don't believe that nutritional supplements or vitamins or herbs are actually going to be very helpful. They're trained and their background is such that they really firmly believe in pharmaceutical medications for being the answer of health problems. And in America, we'll talk about that in another video as well, we take more medications than any other country per capita in the world. So you would think we are the healthiest people. But you answer that question or read the latest headlines in the news. So that doctor doesn't believe that these are going to help, so why would he recommend that he's going to use these products? And if he doesn't use them or doesn't believe in them, why would he use them himself? And how can he turn around and recommend them to his patients? Lastly, the medical system in our country is big business. It's big money for insurance, medical, and drug lobbyists, and they're very powerful, and they work hard to protect their profits. In many cases, we know from statistics that iatrogenic complications are the 3rd largest cause of death, behind heart disease and cancer. So we look at, what is iatrogenic? Well, that is medical complications. And in most cases, it's from properly prescribed, properly taken medication. It's from properly done procedures, and patients don't do well from them, and it causes complications which eventually lead to their demise. So when you look at that, why do I want to follow down that pathway if I'm trying to do something natural or holistic and work with my body and the way it works and the way it heals? Medical institutions and pharmaceutical companies do not profit from getting people healthy, but from treating chronically ill people. They have no incentive or even fight against, and there's numerous cases of this, both very visible public examples and then behind the scenes, they have no incentive to use low-cost, effective natural remedies that help people and help people's body get better on its own. It's up to you, friends, to decide what kind of health journey that you want to take and how you're going to live. How healthy do you want to be? Some people say they can't afford to eat healthy or buy vitamins. But if we took just a fraction of the money that we spend on chronic medications and treating chronic diseases, we could provide healthy supplements for those who can't afford them for themselves. I work to help patients get vitamins at a discount. Would you rather spend your money on medications or nutritionals? If it was up to you and there wasn't any insurance covering it and you had the option, do you want to spend several $100s on this one medication? Or do you want to spend a couple $100s on this collection of vitamins that are indicated by your lab tests in order to provide benefit and support for something that's out of balance? That's up to you. Some patients can use health savings accounts or flex spending accounts to cover nutritional testing and supplement plans. They do work together. Mother Teresa had a comment that I appreciated. She said, never worry about the numbers. Help one person at a time, starting with the person nearest you. And that's my goal to help my patients, is one person at a time. I can't worry about what all the hospitals are doing, all the other medical doctors are doing, what the pharmaceutical companies are doing. I want to help my patients see how they can get better, one person at a time, one vitamin at a time, and one healthy choice at a time. This information, as you know, I've said it before, is accurate to the best of my knowledge. Although I share what I personally do, it's not medical advice, it's for your education. I don't know your special circumstance unless you contact me and we work together. It's recommended you discuss these things with your medical doctor. In closing, if you're wondering how healthy your body is and you want to do this testing, contact me. You can reach me at my office, 814-734-5000, or Rolland Chiropractic at gmail.com. This practice can be done through telemedicine or in person, depending on where you live and how urgent your case is. Until next time, this is Dr. Chad Rolland, wishing you the best of health and happiness.